Good evening and welcome to our COVID-19 update, a special edition on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, to some of the highlights. Today, the Presidential Task Force announces a second death as the NCDC traces 6,000 contacts. Nigerian armed forces ready to enforce restriction order by the president. And now the Prince of Wales is out of self-isolation. We begin with a second fatality from the COVID-19 pandemic in Nigeria, which has been confirmed by the federal government. The Minister of Health, Dr. Osage Hanire, broke the news in Abuja during the media briefing of the Presidential Task Force on COVID-19. Dr. Hanire also affirmed that of the 111 confirmed cases in the country, the majority of those who came in from overseas, with Lagos and Abuja having the highest number of cases. The health minister also promised that 7 more laboratories for testing will come upstream in the weeks ahead.
As of today, the 30th of March 2020, we have recorded 111 confirmed cases of COVID-19 in Nigeria, of which 68 are in Lagos, 21 in the Federal Capital Territory, 7 in Oyo, 3 in Ogun, 2 in Bauchi, 2 in Edo, 2 in Osun, 2 in Enugu, and 1 each in Benue, Ekiti, Kaduna, and Rivers states. Majority of them are persons who came from overseas, and the others have been traced as close contacts of such returnees. The high number of imported cases in Lagos and Abuja is directly due to their function as country gateways for air travel. Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts, and also isolate and treat in order to reduce the spread of the infection.
Disaster management and social development is on seat.
Earlier, the Secretary to the Government of the Federation, Mr. Boss Mustafa, explained that the President has constituted a committee headed by Vice President Professor Yemi Osinbajo to take care of the economic challenges that may arise as a result of the virus.
It is important to state that the national response strategy for COVID-19 has been developed and is being constantly reviewed as dictated by developments. In the President's broadcast on Sunday, 29th March 2020, he announced far-reaching measures aimed at containing the spread of the coronavirus. For economic sustainability, Mr. President has today approved the constitution of an Economic Sustainability Committee to be chaired by His Excellency, the Vice President. Similarly, you must have heard that Mr. President has also approved the exemption of the financial services sector from restrictions to allow skeletal operations in the financial system and the money market in order to keep the system in light operations during this period. We do not desire to slow down the economy in any way.
Now, this is what we know. The Nigeria Center for Disease Control, NCDC, is reporting 111 confirmed cases of the coronavirus. 9 cases in Lagos, 5 in the Federal Capital Territory, and now 2 deaths confirmed. The breakdown by state show Lagos with 68, the FCT 21, Ogun State 3, Enugu, Bauchi, Edo, Osun states with 2 cases each, while Ekiti, Rivers, Benue and Kaduna states all have 1 case reported. But in the meantime, the Lagos State government this evening confirmed that 5 patients have recovered from the coronavirus and have been discharged from the Infectious Disease Center in Yaba today. The state governor, Mr. Babajide Sanwo-Olu, announced this on his Twitter handle, saying that we have just discharged 5 formerly positive COVID-19 patients from our infectious disease hospital after treatments and multiple testing by our specialists. Congratulations to the healthcare team and the patients. The governor adds that the preservation of life is very important to the state government, and the lockdown, which will begin tonight, will help authorities trace and stop the spread of COVID-19. Well, the directive by President Muhammadu Buhari on the restriction of movement in Abuja, Lagos and Ogun states will take effect from 11 p.m. today. The acting spokesperson of the Directorate of Defense Media Operations, Major General John Enenche, has announced the preparedness of the military to swing into action. Addressing a news conference in Abuja, General Enenche says it is important for members of the public to adhere to the order, which is aimed at curtailing the spread of COVID-19. He also disclosed that the only military officer who contracted the virus is recovering at the isolation center located at the University Abuja Teaching Hospital in Gwagwalada.
The Armed Forces of Nigeria is to implement all restrictions on movement in line with the federal government of Nigeria. And for the avoidance of doubt, I want to state here that this includes the presidential directive given by the President Commander-in-Chief during his address to the nation on the COVID-19 pandemic yesterday, 29 March 2020. On this note, I wish to express that the High Command of the Nigerian military hereby solicit for the support of the general public in this trying period of the fight against COVID-19. And this can only be achieved by adhering to all the medical and administrative guidelines being provided by government at all levels. A committee headed by the Chief of Defense Training and Operations in the person of Major General Irabo is in place, interfacing with all relevant ministries, departments, and agencies of the federal government of Nigeria managing the COVID-19 pandemic.
Over 6,000 cases of COVID-19 are to be traced by the Nigeria Center for Disease Control. The agency's Director General, Dr. Chikwe Hekwazu, a guest on our breakfast program, Sunrise Daily, also says that this period calls for a lot of sacrifice on the part of Nigerians.
The principles of care, really, for COVID-19 is to maintain respiratory function as the body recovers. Now, you would have seen and noticed that most of our cases so far have been mild to moderate. We've been fairly lucky not to have had too many severe cases. We unfortunately have had 1 fatality. Our target is to get out results in 12 hours. We're not there yet for every result. We get many of them out in 12 hours, but we're not there yet because what we can do is sometimes there's a positive, it's borderline, we make a decision to repeat. So we have released a new case definition yesterday, defining exactly who needs to be tested. We will apply this strictly so that as long as we don't have the number of tests that we need, which is the reality at the moment, we're working very hard to increase that. But as long as we have these limitations, we have to focus on those who need it the most. At the same time, work very hard to increase the capacity of our testing, which is what we're doing day and night, and we're really assuring Nigerians through different pathways. There are new test technologies that have just been approved. We've already started the procurement process for that. They should be in the country in the next couple of weeks. So that will then that will really radically increase the throughput that we can have for testing. We're following over 6,000 contacts of these 111 confirmed cases across these two cities. Every time we have a new case, we add about 50 to 60 contacts that we then have to follow every single day for 14 days. If we can't do this, if we don't have access to these cases. So this is really one of the reasons, just one of the reasons why Mr. President took this very difficult decision. And it's not just to stop movement. It is to enable us and our teams, the Lagos State team, FCT team, reach the contacts, keep them at home, make sure they're supported, and see whether we can really use this time to buy some time to get ahead of the cases.
So joining us in the studio to tell us more about the COVID-19 response in Lagos State and across the country, I'm now being joined by a public health physician, also a member of the Association of Public Health Physicians of Nigeria, Dr. Ibipo Abdurrahim Salami. Thank you for joining us on the program.
Thank you for having me.
So listening to the NCDC Director General, it seems like it's a race to the 11 p.m. deadline for Lagos, Ogun State and Abuja. But when he says over 6,000 being contact traced, does that give you cause for concern?
Yeah, it should give us cause for concern as a people, because it means, I mean, you only have as much resources. And what it means is that we're having to check up on 6,000 people just to see that if there's any case at any point in time, we're able to catch them on time and limit spread. Now, what this means is that there's a large amount of resources that we have to use to do this. And we do not want this to be higher than what our capacity can safely take, really.
Are there challenges you foresee for healthcare professionals in Nigeria?
I mean, we've been inundated by the challenges that healthcare professionals continue to face all over the world. It's not a matter of if, it's a matter of when. I mean, these infections will eventually come here, and we will be the ones at the front line. So there are challenges. We've had existing challenges before now, the challenges of number, training, availability of equipment and resources and consumables. So these things will happen. We're hoping that based on the measures that have been put in place, the sit-at-home measures, the move to contain the infection, that we can slow down the amount of resources in terms of manpower and consumables that we will need, so that we can safely be able to afford what it will take at every point in time.
All right, we still have Dr. Abdurrahim Salami in the studio. More stories in our special COVID-19 update is the National Agency for Food and Drug Administration and Control, NAFDAC. They've ordered the manufacturing of chloroquine for emergency stock for possible clinical trial treatment of COVID-19. Now, according to the Director General of the agency, NAFDAC is giving expedited provisional approvals for the manufacture of any commodities for preventing contracting the disease, like sanitizers and drug or medical device that could be used for the clinical trial testing and treatment of COVID-19 pandemic. NAFDAC is also advising the public to desist from its use without the guidance of a medical doctor or clinician for cases of clinical trial treatment. Back in Lagos, the Lagos State Governor Babajide Sanwo-Olu has described the restriction of movement announced by the president as a necessary step in the battle for life against the COVID-19 pandemic, which he says still has no known cure. According to the governor, the restriction will give room for medical workers to deal faster with cases, as those infected will be easily identified and also isolated. In a statement, the governor gave the assurance the Lagos State government, in partnership with the Federal Ministry of Health the NCDC, the World Health Organization, among other institutions, will stop at nothing to halt the spread of the coronavirus. While addressing concerns over security, the governor says the police, other security agents have been directed to ensure that criminals do not take advantage of the restriction period. Still to come on our COVID-19 updates, global news, Israeli Prime Minister to be quarantined after close aide tests positive for COVID-19. You join us again. Well, let's go over to the Oniko Stadium, where the Lagos State government is setting up as another isolation point for COVID-19 patients. Tents have been raised. Health officials, workers are seen cleaning up preparatory for use. Although our camera wasn't allowed into the tent, our correspondent, Olu Phillips, managed to get these pictures outside the tent, which you are seeing there. In the meantime, Ogun State, which will also observe the lockdown order by the president, has confirmed the readiness of its isolation facility that's located in Ikenne. Governor Dapo Abiodun, in company of state officials, carried out an on-the-spot assessment of the center today. The 120-bed isolation center, according to the governor, will cater to cases of COVID-19 in Ogun State. Demonstrations were made by the Ogun disinfecting squad to the governor. The squad are expected to decontaminate markets, streets, and also other public places. Well, joining us for more to dissect the coronavirus pandemic in Nigeria is an infectious disease expert and nuclear chemist, Dr. Abdul-Jalil Tafawa Balewa. He joins us from our Abuja studio. We'd like to welcome you to the program. Joining us via Skype as well is Mr. Joshua Oyeni. He is a social entrepreneur, also the convener of Ambassador Summit Africa. He joins us from New York. Thank you, Joshua, for joining us at this time. Let's talk to you, Dr. Tafawa Balewa, on the steps taken by the government to restrict movements and travel. What are your impressions on what Nigerians should do this period?
It's a very brave step that the government took, and a very necessary step, because the way that this coronavirus is spreading, especially in the southern part of the country, it's important to be able to limit it to the entry points. And Lagos and Ogun State are the real entry points into other parts of Nigeria. I think Port Harcourt should have been included. It isn't. But what the government is doing and what CDC has laid down, and the beautiful, intelligent work being done by the Lagos team, especially the Commissioner of Health, is admirable.
Let's go over to Mr. Joshua Oyeni right now, especially your reactions to Nigerians living in the United States. New York has been a hot spot, you know, in the pandemic. How are people faring, seeing as the country, the United States, has been affected by the virus?
Okay, thank you, Dr. Channels TV, for having me. Well, I'm currently in Brooklyn, New York precisely, and the situation is very intense. COVID-19, coronavirus disease, as it is a reality with over 59,000 infected New Yorkers alone. New York is way ahead of many of the cities of the world as it relates to this pandemic. And currently, the governor of the state is really, very seriously under a lot of pressure, because he's anticipating doubling and quadrupling of hospitalizations in New York, with deaths hitting 1,000 estimated by today, the 30th of March. It's a very intense situation. Businesses are shut down, industries. You can imagine New York being the center of commerce and industry in the entire United States, being brought on his knees. Everything's going down, and the government calls it New York Pulse. You go out on the street, nothing is virtually happening. Times Square is deserted, downtown business areas are deserted. It's really intense, and the government of the state, and of course the United States as a whole, is really trying to bring it under control. As it is, Nigerians have a choice, but to also obey the law of the land, which is to stay indoors till April 15th, the first instance, and then we'll try and see whatever the situation will turn out to be. But as it is right now, Nigerians alike are trying to put everything, the best they can. They're trying to stay safe. We're trying to be able to contain, the situation. Ensure that we are, taking care of our hygiene, and at the same time, doing all we can to digitally.
This is Channels Television's breaking news.
Well, news just reaching us says the Oyo State Governor, Mr. Seyi Makinde, has confirmed that he is tested positive to COVID-19. The governor says he is asymptomatic and that he will continue to self-isolate. So Oyo State Governor Seyi Makinde confirms he has tested positive to COVID-19. We'll bring you more update on that story. Let's go over to our guest in Abuja, Dr. Abdul-Jalil Tafawa-Balewa, who is an infectious disease expert. Now we've heard from some public health physicians who say we should wear masks and others who say we shouldn't, with instructions on how we should. What do you recommend?
I think we should temper justice with mercy. Anywhere that's so occluded and the people are in very close contact of one another, I think you should wear a mask. But if you're in a well-ventilated environment, light population density, you may just... We haven't gotten to a stage where you should have to wear the mask all the time. If you're in a well-ventilated environment, you shouldn't have to.
Let me ask you, Ellen Johnson Sirleaf, she made history as Africa's first elected female president in Liberia, and she's been speaking out about the lessons learned during the Ebola crisis and how the world responded. Well, she's also expressed her fears that even though African nations have perhaps so far been spared the worst, it's only a matter of time until it batters the continent. Is this a fear that you share, that Africa might become the epicenter of the pandemic?
Not quite. A lot of people might say we don't have good health system and so on and so forth. One of the things that we have that's going for us that we should know is that we don't have the high impact population densities like in New York or in Beijing or Wuhan or all those other cities and in Europe. Most of our people are still living in rural environments, and what the government is doing now by cordoning off the large population centers where we've seen these diseases come, like Lagos and like Ogun State, which is another bottleneck into the rest of the nation. I think that we're in good stead, and we should be able to do well by just managing ourselves a lot better. Everybody should know what to do for prevention. Cleanliness is next to godliness. This is the time that we should all believe in that. But I don't see us falling into some major epidemic as had been suggested by Madam Sirleaf.
We appreciate your time, Dr. Abdul-Jalil Tafawa-Balewa, an infectious disease expert and also a nuclear chemist. Thank you for joining us. Now to some of the global updates. Clarence House says the Prince of Wales is out of self-isolation 7 days after it was reported that he had tested positive to COVID-19. The Prince of Wales, Duchess of Cornwall, were isolating at Birk Hall, their residence in the Balmoral estate. And Israeli Prime Minister Benjamin Netanyahu is due to go into quarantine after a close aide tested positive for COVID-19, a local newspaper reports. His office said he would enter quarantine along with his close advisors as well. And the number of confirmed coronavirus cases have increased in East Africa Rwanda reporting 10 new cases, increasing its total number to about 70 cases. But finally, with our guest here, just before, as we wrap up the program, we're hearing the breaking story of your state governor, Seyi Makinde, confirming he's tested positive, but then he's saying he's asymptomatic. Can you explain what that means?
Well, that is one thing we find quite interesting about the infection that results from this. Many of the people who get the infection will be asymptomatic. Some of the people who get the infection, especially when they have pre-existing conditions, maybe they've been ill from some other diseases, may end up having a more serious form of the infection, which could be fatal.
So asymptomatic means you can't see.
Symptomatic means, yes, I could not be able to tell the person has an infection unless the person has done a test. Now, the challenge with that is that if he hadn't taken the test, he could be able to transmit the virus to someone else without him knowing or the person getting an idea that they've just got it.
We'd like to thank you. Thank you so much, Dr. Ibipo Abdurrahim Salami, a public health physician. Thank you for joining us at this time. And of
course, thank you for having me.
Remember, the World Health Organization has a live feed of all that's happening on the pandemic across the world. Be sure to take a closer look at some of the numbers in real time. Well, that's the program at this time. We would like to hear from you. Tweet at us at Channels TV/COVID-19 Update Special Edition. It's a 30-minute daily update, and we'll be back again at 9 p.m. Join us then. A reminder again of our breaking story that Oyo State Governor Seyi Makinde has confirmed he is positive to COVID-19. The governor says he is asymptomatic and that he will continue to self-isolate. I'm Millicent Wonka. Bye for now.